Welcome to Advanced Oxygen Therapy's brief setup training video on the TWO2 therapy disposable system. You'll receive a 10-litre oxygen concentrator. On the back, there is a filter that should be washed weekly with warm soapy water. Central to topical wound oxygen therapy is the controller. The unit monitors the pressures and controls the therapy for the duration of the treatment. The power cord is attached to the bag and secured using a Phillips head screwdriver so that the cable is not accidentally removed. The oxygen supply hose is screwed in place on the side of the unit. The blue hose assembly is attached on the other side. The nebulizer cable is also attached on the same side as the blue hose assembly, lining up the red dot on the cable with the unit. When using humidification, attach the cable to the nebulizer cup and fill the cup with an ampule of sterile water. The disposable boot arrives in a box of 20 units. When the boot is unfolded, you will notice the rib area that inflates the boot first, the cuff area that seals the limb inside the boot, and a channel that reads the pressures within the cuff. In order for the correct pressure readings and proper boot inflation to occur, ensure the channel and the reinforced tab are kept free from kinks and bends. Line up the notch on the hose assembly with the notch on the boot and attach the hose. If you are not going to use humidification, use the cap to close the port. If humidification is used, attach the nebulizer cup to the port and ensure that the cup is facing upwards. Turn on the oxygen concentrator by pressing the toggle button at the front of the unit. Next, turn on the controller by pressing the top button. It will prompt you to inflate the bag. Press the bottom arrow to inflate the bag. Ensure the valve on the cuff is closed and put the limb inside the boot, just below the fold behind the knee. Continue to follow the prompts on the controller. Press the bottom arrow to inflate the cuff. Then press the bottom arrow again to start the therapy. The pressure in the boot is displayed on the screen, where it will cycle about 2.5 times a minute. While therapy is in progress, check there are no kinks or bends in the channel so that the therapy will not be interrupted. When 90 minutes of therapy are complete, the controller will beep and prompt you to stop the therapy. Turn off the controller by pressing the top button. Then turn off the oxygen concentrator by pressing the toggle button. Release the valve on the cuff so the limb can be comfortably removed from the boot. Then detach the hose assembly and the humidifier components, ready for the next use.